Good evening, everybody. Today I'm going to start our meeting. It is about counseling. You have different types of counseling that you may face in the communication station. Counseling about disease, counseling about procedure, treatment option or medication, counseling about HIV, and genetic counseling. In each of these sessions, you have to arrange your mind. How are you going to talk and what are the items you have to fulfill? So starting with the first one, counseling about disease. What are the common disease coming in the exam? We have Parkinsonism, Alzheimer's disease, motor neuron disease, and usually motor neuron disease can come as breaking bad news and counseling about the disease, and can come as counseling about procedure, insertion of a PEG tube or feeding tube. Multiple sclerosis is important and common scenario coming in the exam. HOCM, cardiomyopathy, whether postpartum cardiomyopathy or chronic AF or postpartum cardiomyopathy. End-stage renal failure, renal transplantation, autosomal dominant polycystic kidney disease, celiac disease, inflammatory bowel disease, irritable bowel syndrome, hysterical conversion reaction or functional disorder, asthma, angioedema, ischemic heart disease, or lifestyle modification scenarios, which are different scenarios, including uncontrolled diabetes, obesity management, smoking cessation, hyperlipidemia, or diagnosis of a new diagnosis of type 1 diabetes. These are the important diseases that you have to have a good idea about each of them. So if you face one of them in the exam, you can cover these items. As we mentioned in the first lecture, if you remember, you start by explaining the disease, the cause, the course, expected complications, available treatment, and if there is any major complication for this treatment, or one of the side effects that can annoy the patient or raise his worry, like changing color of urine, changing the color of contact lenses, raising of some blood test like liver test or kidney test, changing blood count, the prognosis or outcome of the disease, and the precautions or red flag of the disease. The second, and we mentioned before, counseling about disease, and we took an example. I think we took a case of renal failure. The second type of scenario, which is counseling about procedure, the common procedure which come in the exam, upper GIT endoscopy, colonoscopy, PEG tube insertion, colectomy and colostomy, intercostal tube insertion, Hickman line, lumbar puncture, percutaneous nephrostomy or PCN, renal biopsy, bronchoscopy, lymph node biopsy, renal transplant, renal dialysis, ICD or pacemaker insertion, deep brain stimulation as a management of resistant essential, benign essential tremor or Parkinsonism resistance cases, and cognitive behavioral therapy. These are the types of procedures that you have to have an idea about and commonly appear in the exam. When you start counseling about procedure, and this is new item we are going to discuss today, inshallah, you have to cover certain points. First of all, explain the underlying condition. Why you need this test or this procedure, and why it is the best procedure to be done. Is there any contraindication? For example, if the patient on oral anticoagulant and he is going to do invasive procedure, he should stop the anticoagulation for 2 days and be on low molecular weight heparin. Certain precautions that the patient have to be taking before the procedure. Patient going to take contrast media and he is taking, for example, pseudophage or on ACE inhibitor or diuretic, he should stop this medication before the radiocontrast intake. You should ask about if he has previous experience with radio contrast, and if he has allergy to this contrast, if he developed a sort of allergy to this contrast. This is important. If he has any kidney problem before giving him a contrast. This is what is meant by any contraindication for the procedure. Then explain the procedure details. What is going to happen before, during, and after. What is meant by before? The patient should be coming fasting, usually 6 to 12 hours according to the procedure. He should, in colonoscopy, there is special preparation for the colonoscopy. He should do enema and take laxative. And if the patient diabetic and prepared for colonoscopy, he should be admitted for preparation in the hospital. So during the procedure, this procedure will be done in the operating theater under completely aseptic technique, or taking the antiseptic precaution or sterile precautions. It is done by a group of well specialized physicians who are doing this procedure many times, and they are expert in it with minimal complications. And you start to explain in brief what is this procedure, what it entails. Then after the procedure, he'll be kept in the hospital for 6 hours for observation of his blood pressure, pulse, and if everything is okay, then he will be discharged home. It is important to tell the patient he may feel drowsy because of the sedation during the procedure, so better to bring someone to drive him home. After explaining the procedure in details, you should be honest with your patient and explain or mention to him the expected side effect and how to monitor, and what are the red flags that the patient have to come back to the hospital if he develops. With any procedure, it is expected to have some bleeding, some pain, but if you experience severe bleeding, uncontrolled pain, or agonizing pain, I mean, or if you felt dizzy, then you have to immediately turn to the medical encounter. Then explain what if he doesn't do the procedure, what are the drawbacks of not doing this procedure, how this can harmfully affect his health, or the diagnosis or his treatment or whatever, depending on the procedure. So you should explore always when you are discussing procedure, whatever the procedure is, the pros and cons of doing and not doing the procedure. If the patient refuses, ask him why. Maybe he is afraid from the procedure itself. Maybe he has previous past hard experience with one of the relative or friends or whatever. Maybe he has certain worries that you have to explore first, then assure and explain how you can avoid. So you have to discuss his worries, explore it, assure him this can be avoided, and explain how you can avoid this. Ask about the concerns and expectation. It is very important in counseling, very important to check acknowledgement. What is the take-home message? How much you got? Why? If the patient has autonomy, as we mentioned in the first day or the first session, the patient has the right to accept or reject treatment or investigation or procedure based on fully informed data. So he should be able to take decision. In order to be able to have this autonomy, he should be competent. Competent means he is adult, conscious, and competent, which means he is able to receive, retain, and recall information. So he is able to recall the information you gave to him. Not only that, but also give a decision based on balancing the benefits and risks. Even if he knows the risk well, he insisted not to do the procedure as you mentioned, it's okay, it's his own right. But don't shut the conversation at this point, just over other option, and including the option no treatment. Don't consider no treatment is one of the options. If he accepts the procedure, then ask for consent. If he refuses, give time to consider. Give him help in the form of pamphlets, brochures, or website, or possibly video, simplified video in YouTube links that simplify the procedure to him. I will return back to the issue of consent. This is very important legal issue in counseling scenario. If you are counseling about treatment or counseling about investigation, and specifically investigation, invasive investigation, you have to, or surgery, you have to have a written consent. There are different types of consents, whether verbal or written, but I'm talking about the written consent. Written consent, not taking for the blood test except HIV and genetic test. For all type of procedure or invasive procedure, you have to take a written consent. In this consent, all the details about the procedure is written. You have to tell your patient, you have to read them carefully, and feel free to discuss anything that is not clear for you. This consent is protective for you as a doctor and for your medical team against company. If you are talking to the patient, you ask him and he is convinced about doing the procedure, you ask him to sign a consent. If you are talking to a relative of the patient, you have one of two options. Ask the relative if the patient has advanced directive or lasting power of attorney. What is the advanced directive? The advanced directive is a paper that the patient signed before being incompetent, explaining the different situation or procedures that may be done to him at time. For example, patient with advanced stage disease or terminal illness or whatever, or even COPD, you start to find that your patient condition is deteriorating. You mentioned to him at the time you may be not able to take the proper decision. In such condition, you have to check which procedure of this you would like to accept or to reject. And the patient has the right from these procedures, he has the right to accept any, but only to refuse for resuscitation. Lasting power of attorney is a signed paper, again, is legal document, both of them advanced directive and lasting power of attorney are legal documents which substitute the patient decision. Lasting power of attorney, it is like contract written on the the legal advisor in the hospital, witnessed, signed, in which the patient nominates someone else to take decision for him. In the lasting power of attorney, it may involve medical decision or a financial decision, like payment for the expense of, for example, of hospice care, for the whatever payment procedure, insurance, it will be his decision. So I will nominate someone to take decision in behalf of myself if I lose competence, and this person is not essential to be part of the family. He may be a friend, a colleague, someone, a doctor, whatever. But this one decision is respected as if this is the decision of the patient, unless in life-threatening condition. Type. If you are talking to a relative and the patient didn't left advanced directive or lasting power of attorney, then it is the medical team decision to do what is in best interest for the patient. These are the different type of advanced directives, whether living will, in which the patient signed what procedure he accept and what he reject, organ donor card, do not attempt resuscitation, burial wishes. in certain ethnic groups or religious groups. And medical proxy, which is the lasting power of attorney to nominate someone to take decision for him. The second type of counseling, or the third type, is counseling about treatment. There are many treatments which can have many side effects, which are major side effects. For that, you have to counsel the patient about, like steroid, amiodarone, chemotherapy, bisphosphonate, insulin, and so on. Some other medication may appear also, like fingolimod for treatment of MS, like riluzole for treatment of motor neuron disease. So again, it is not the amount of information you know about the drug, but there are important points you have to tackle. The next type of counseling about HIV, and lastly, genetic counseling. I'll postpone genetic counseling till we do first the scenario of counseling about procedures and come back to genetic counseling. I will stop for a few seconds and take your comments or questions. Any comments or questions? Okay, we is going to take the case. Hello? Anyone, are you listening to me? Okay, anyone want to run the scenario with me? Dr. Barakat. Okay, let's start. Mrs. Rehan, 32 years old lady with long history of lupus nephritis. Now she presented with acute kidney failure, oliguria, and frank hematuria. Your consultant asked you to talk with her about kidney biopsy. Your task to counsel her about the biopsy and manage her concerns. I'll give you 2 minutes to arrange your suit, then we'll start. Dr. Barakat, are you ready? Mm. Okay, till the host come again. Okay, no. Difference between a lasting power of attorney and advanced directive. Lasting power of attorney, this is a paper like a contract. You nominate someone, you assign someone who has the right to take medical or financial decision for you in case you lost capacity. There is someone else who is going to take the decision. But in advanced directive, there is no someone else. It is a paper. You decide what treatment, what investigation to be done, and what not to be done, and what treatment you accept and what you don't accept. So there is no other decision. But in the paper, you check. You requested, for example, not for DNR, do not attempt resuscitation, do not ventilate, refuse any surgery, whatever. So you have to, as a medical doctor, respect this advanced directive. But in the lasting power of attorney, there is a human, someone who is going to take the decision for the patient according to a legal document which is written and signed and witnessed. Okay, Dr. Barakat, you are ready? Let's start.
Dr. Barakat can talk. He is on mute now.
Okay, thank you, Dr. Okay, Dr. Mona, can we start?
Yes, please.
Yes. Good evening.
Good evening.
I am Dr. Barakat, one of the doctors in the clinic. Very nice to meet you.
Pleased to meet you, doctor.
Can I confirm that you are Mrs. Reham, 52 years old?
Yes.
Mrs. Reham, I'm here today to discuss some issues related to your condition. Is it okay with you?
Yes, please.
Yes. At first, do you want to attend this meeting with us?
No, it's okay.
How do you feel now, Mrs. Reham?
I'm just worried about my condition, doctor. This blood in my urine. I pass very small amount of urine, and I'm not feeling well generally. I'm anxious about the cause of my symptoms.
Yeah, I appreciate all your feeling and your fears. We are here today to help you regarding this issue. But first, can you explain me how much you know about your condition?
Actually, doctor, I have no much to say. I've been treated from lupus since 5 years now. I have these giant aches and some rash on my face. But in the last couple of days, I have noticed that I barely go to the toilet, passing very little amount of urine, and it is very dark, you know, like cola. I went to the GP. He asked for some blood test, and after the result appeared, he referred me for you. So I wonder, is there anything serious happening?
I do appreciate your concern. I will answer this. But can you tell me what's your expectation about the cause of this problem in your rotor work and your urine?
I'm not sure, doctor. At the start, I thought it could be related to some sort of food I took or something like this. But when I started to have more symptoms, I don't know, I got really confused. The GP told me that he have to check my kidney function, but I wonder why he's suspecting kidney problem. I never have any kidney problem. Hello? Hello?
Rehan?
Mm-hmm.
Yes.
Dr.
Anyone
Barakat?
explain it? Yes.
Yes. The GP
Anyone
told me that he has to check my kidney, but I wonder why he is concerned about my kidney. I have never complained about any kidney problem before.
Yes. You know, Mrs. Reham, you have lupus disease. This disease is unfortunately problem in our defense system. Instead of attacking external parts, attacking itself. One of it attacking several parts of our body, attacking our skin, attacking our joints, and sometimes and mainly attacking our kidneys. In many conditions, it attacking our kidneys through problem in defense system. As I told you, it attacks itself on self. It attacks our kidneys. It is affecting it in different stages and different parts. So in different ways, this lupus can affect our kidneys. So your GP is thinking about you have problem in your kidneys because of this lupus.
But I have this lupus since 5 years, and I have never had any kidney problem before.
I do appreciate your concern and your feeling again, but what I can tell you now that this lupus is differently acting, not acting in direct way. It has several ways or several mechanisms to affect your kidneys. Sometimes it came suddenly and in a very short duration, like what happened to you now. So we are thinking about this is maybe the cause. Also, our kidneys may not make symptoms or you have symptoms until a stage that it affecting our kidneys so much, so you have these symptoms. So we need to know more what is going on in your kidneys.
So how serious is my condition, doctor?
I'm so sorry to tell you that this is serious if not treated well. If you didn't deal with it correctly and do the proper management and start it as soon as possible, it can be serious.
Oh, how serious it could be, doctor?
Yes, as I told you, it affecting our kidneys in different ways. Such may cause damage to our kidneys if we not treated well. So we need to deal with it as soon as possible.
Oh. So what is the next step, doctor? Are you going to admit me? Are you going to give me any medications? I'm not sure. What are you going to do then?
Yes, I will come to this point now. But first, I want to reconfirm that you are going with me and you are coping with what I said. Do you want me to
Yes.
explain more about this?
No, it's okay. I'm
Okay.
completely concentrating with you.
To know how much extent this lupus or a simple injection to just numb your skin at this point, to introduce a small needle, very small needle, to take snip or part of your kidney to be examined by the tissue doctor. This will be done under complete aseptic condition. What we mean that it will be clean to decrease the chances of you to have bug infection. Are you following me? Hello? Are you following me?
الو
الو السلام عليكم.
يا دكتور رضا، الدكتور بركات ميوتد برضه.
Yes, Dr. Mona.
اوكي دكتور. Okay, you can continue. I stop the time.
Are you hearing me right now?
Yes, yes. Continue, please.
Yes. أنا مش عارف الصوت قطع عند إيه بالظبط يا دكتورة، معلش ممكن تضيفي.
You mentioned about the SNP
أنا كملت
procedure.
كلام بعدها.
You mentioned about the procedure in the theater.
Yes. This procedure will done by an expert doctor who is expert in this situation. How does it make sense for you, Mrs. Rehan?
I'm not sure, doctor. Maybe it is frightening, but anyhow, I'm not sure. Is there any complication for this procedure?
You know, in medicine, generally, there is no procedure that is 100% safe. Every procedure, every operation we do have its own risk and its own benefits. So we are always outweighing benefits against risk. Your condition benefits is much more. That will help us to define to how much extent is this lupus affecting your kidney and how we will deal with it.
But you mentioned that this problem is related to lupus. So why don't you just give me a treatment for this lupus, and this will control the problem without doing this SNP?
I do appreciate your feeling and your concern again. As I told you before, this is mostly due to lupus, but there is many other factors that can cause this. And lupus itself affecting our kidneys in different ways.
Yes.
We don't know how much it is affecting our kidneys and how we can deal with it without this SNP. We will treat you blindly without specific treatment, without going to the target directly.
Is the treatment going to improve what happened to my kidney and return me to my usual state, or am I going to need for dialysis?
It is early enough to answer these questions. As I told you before, we don't know how is lupus affecting your kidney and to how much extent is this affecting your kidneys. And this will depend on what we can find in this SNP. So I'm telling you about the importance of this SNP that we need to do.
You know, doctor, my son's birthday is within a couple of days. Can I postpone this SNP till after the birthday?
It is wise to do it right now as your kidney function is much affected, and we need to do it right now to take the right decision to deal with it. So it is wise to do it as soon as possible. I will talk to my consultant to define when you can do this procedure, and I will give you the date and the appointment and also the paper with the instruction before the procedure as soon as possible.
I think I need some time to think about, doctor.
Yes, this is right. You can take your time. You can arrange another appointment, even with my consultant, if you want to arrange another appointment to seek another opinion. This is your right. I know this is much information to absorb in one appointment, so this is your right. But first, I wanted to be honest with you. I wanted to complete explaining about the procedure itself, especially the drawbacks. As I told you before, every procedure has its own drawbacks and its side effects. As you know, it's bad effects. But although it is rare to happen, but you need to know about it. We are doing our best to prevent this from happening. But there is a chance to have such problems like you can catch bugs during this procedure. But I want to assure you that we are doing this under committed safety condition and under clean circumstances, so we can avoid this catching these bugs. Yes, also there is another risk to injure your another organs, and also there is some risk of bleed. Sometimes we need to take another SNP from your kidneys because the one can't give us a conclusive decision. How does
No.
it make sense for you, Mrs. Hayham?
I'm just feeling afraid, doctor. I think I need to reconsider.
Yes, I know. I do appreciate your feeling, and you can think, and I will leave you my hospital contact number. If you have any other queries or any questions, I can answer you. We are all the team medical team here is beside you in this situation. Can I ask you what is your concern?
I'm concerned, doctor, about the fate or the treatment that is going to give me. Is it going to correct my condition completely or not? And also concerned if this condition transmitting to my kids, and if I refuse to do the SNP, does this mean that you are not going to give me a treatment?
No, at all. I will start with the last one. We will give you treatments and we will manage as much as we can, but this will be blindly. As I told you before, to give the correct treatment and the correct way of management, we need to do at which stage is your lupus affecting your kidney. Regarding the other concerns that is your kids, regarding your kids, this is not a genetic disease, it's not running in family, but your kids may have a higher risk than their colleagues to have this disease, as it is more risk to have this disease more than others. Also regarding the first one, the first concern is that I told you before, it is early enough to judge. It can be returned. You can be returned to your normal life, your normal condition before. This will depend on the result of the tissue snap that we can
احنا
take.
التايم كده فينش دكتور بركات. بس احنا فاضلنا السمري طبعا والتشيكينج اكنولجمنت فيري امبورتنت.
بس هي فكره الانتربشن كتير والله يا دكتوره معلش.
انا I added والله تايم بس you did it perfect. Thank you very much. You did it more than perfect. طيب first of all introduction as a structure very good. You introduce yourself to confirm an identity who asked if she anyone to attend because you are breaking bad news still with counseling about disease and counseling about procedure. These three items are the medical issue in the scenario if you are asked by the examiner. Breaking bad news, counseling about disease, counseling about procedure. Legal issue in this scenario definitely is the consent. Ethical issue, autonomy, beneficence, non-maleficence, or justice. Back to the scenario, how much you know about the condition. She has lupus. I will start from where she ended. You know, lupus is one of the diseases that affect your defense system, in which your body defense gets confused, start to attack different part of your body, like your joints and skin as you used to have. But unfortunately, this time it hits your kidney. You know, lupus has variable ways of presentation, and also in the kidney. It can affect the kidney by different ways. Another important issue that can be the cause of your problem may be the painkiller you are taking if you are. So there are different possibilities for your kidney problem, which include different types of affection that the lupus can have or the painkiller you are taking. So in such condition, our consultant sees that the best way to accurately diagnose and accurately give you the proper treatment is to take a snip from your kidney. Do you have any idea about this? It is a simple outpatient procedure. It doesn't need admission. You will come fasting for 6 hours. This will be done on the operation theater, where you are going to take some blood to cause some drugs to cause sedation, so you feel no pain or minimal pain after this procedure, and then under image guidance, we precisely take a very small part of your kidney, like a small thread, which is examined later on after the microscopy to detect which type of lupus affects your kidney, or which type of affection the lupus caused in your kidney. After this, you will be kept under observation for 6 hours in the hospital, and then you can return back. You, to be honest with you, you can feel minimal pain, which can be overcome by giving you some painkillers. You can have some change in the urine color. She is already having hematuria, by the way, and which is accepted. But if you notice that the pain become agonizing or intolerable, you felt dizzy, or there is bleeding, you have to refer back to the medical encounter. In our case, I'm not going to mention this because this case is of acute nephritis. She has oliguria, impaired kidney function. She is for admission. So just you have to tell the treating doctor right now if you experience any of these symptoms. That's because she is for admission. Let me ask you before going more, are you following me?
Yes,
I hope that I make things clear for you. Let me ask you, are you taking any blood thinner medication for any reason? Because you are going to do invasive procedure. We'll have to ask about blood thinning medications. This is a contraindication. How do you feel about what I said? Do you think you agree with me or the medical decision to do the procedure or not? If she agreed, then you have to sign a consent. All the details about the procedure is written on it. Read it carefully and feel free to ask about anything which is unclear. All our team will be ready to answer all your questions. If she doesn't agree, why? Afraid, assure her, despite the complication which can occur, like bleeding, pain, introduction of bugs, this is minimized in the good hand. And our team is one of the expert team doing these procedures many times with minimal complication. So I assure you that things will go in the good way. How do you feel about this? If she's still hesitant, why don't you think about, and I can sit with you again or arrange a meeting with my consultant. He may be more able to convince you about the procedure. Be sure that give the alternatives treatment. If you insisted to refuse to do this SNP, we are going to give you treatment based on the clinical situation you are in. But this will not allow us to be precise in your diagnosis. We will not be able to check the extent of kidney affection, and thus you may lose a precious chance to be diagnosed and treated well. Regarding your kid's birthday, give her any good wish. Then tell her, I'm sorry to tell you that, but we are in a critical situation. You know the kidney is a part of our body responsible about removal of toxins and excess water from our body. When it starts to fail, the progression may be rapid, and this may seriously harm your kidney. And in some types of affection of the kidney in lupus, time may have a great impact. The earlier we start treatment, the better outcome you got. How do you feel about this? Then summarize and ask here how much you got from what I said, or what is the take-home message you got from what I said. And checking acknowledgement is very important in case of counseling, because it decides whether you succeed in your counseling or not. Have you concentrate on the important information? Have she got the important information or not? So the success in this station, not to convince her or to fail to convince her. The success depends on that you deliver the information, and she now able to know or to weigh the benefit. She is the one who has to weigh the benefit and risks. So she knows the benefits, she knows the risks, and she takes the decision. It's her own decision after that. Okay. Thank you, Dr. Barakat. You did it perfectly. بس الانتربشن أنا ما كانش لي لازمة. Any questions?
Yes. الحالة دي المفروض أقول لها consent ولا لا؟ Should I talk about the consent? if she need time to rethink. But she told me that she need time to think. I will tell her if you agree to do the procedure, you will sign a consent.
If you agree, you have to sign a consent. Yes, you should mention it.
Okay. The second question, I was asked in my first trial about consent. Who is responsible to take the consent? The examiner told me that you are the one authorized to take the consent when I talk to the patient about the consent.
You talk to the patient about the
ideal answer for
consent
this?
depends on the type of consent. For example, if it is consent for surgery, you are, for example, talking about in a patient with ulcerative colitis, and she's going to undergo colectomy. The surgeon or anesthetist who is the one responsible about the consent, not you. But if it is for procedure and you are the kidney doctor, it's your own yes, your own responsibility.
My case was this wire reposition in patient with heart block
Pacemaker
that need pacemaker insertion. Yes, she needs a reposition of the pacemaker wire.
Yes.
And I told her about reconsent. She needs to sign another consent again. But the examiner asked me, are you the one who is authorized to take the consent from her?
You are the cardiologist?
So,
what is your
I was a senior house officer in the medical department. She was admitted.
Medical department ولا في cardiology?
Medical.
No, if you are the senior house officer in cardiology department, you are the one. In the general medical department, no. Like our case, if you are in the nephrology department, yes, you are the one. Our radiologist, according to where it is, it will be done. Okay. But if you are general medicine and no, it is not your own authority. Any other questions? Or thank you, doctor. Thank you for sharing. Any other questions? Any questions, doctor? No comments? So I'm going to move to the next part, which is genetic counseling. In genetic counseling, actually, it is very common scenarios coming in the exam with a lot of debate. First of all, you have to know, is your illness treatable or preventable or not? We can classify treatable or preventable diseases in one category, like hemochromatosis, I mean primary hemochromatosis, or familial, Wilson's disease, autosomal dominant polycystic kidney disease, HOCM, familial colorectal cancer, familial breast cancer or ovarian cancers, or non-treatable or non-preventable nor preventable disease like Huntington chorea, for example, and many other genetic disease for which there is no treatment and no prevention either. So you start to talk to your patient based on this. If the disease you are going to talk about is treatable or preventable, you have to encourage him to do the genetic test. There is two exceptions on the diseases I mentioned, which is HOCM, which are HOCM and autosomal dominant polycystic kidney disease. They don't need genetic test, but just when the person reaches the age of 18, he starts to follow up by ultrasound or by echo for HOCM. If the disease is not preventable nor treatable, so you just being on the discouraging side. Be aware that you are not the one who take the decision. You don't have the right to tell the patient, no, you don't have to do this test, or you have to do this test. This is a bad way, or it is not accepted at all. The patient is the one who is going to take the decision, but you explore the pros and cons of doing the test or not doing the test. You are going to be favoring doing the test in the first group or not favoring the second group. Okay, so let's ask ourselves some questions. First of all, do you need to do the test or no? When and why? If the disease is preventable or treatable, you need to do the genetic test. When? Prior to the onset of symptom, if it is preventable, like Wilson, like familial hyperlipidemia, like colon cancer, like familial breast cancer, you should look for the BRCA 1 and 2, like familial ovarian cancer. So you have to start as soon as possible checking for the gene. Like, for example, also in men too, medullary carcinoma of thyroid, to undergo prophylactic thyroidectomy early in age. But in case of autosomal dominant polycystic kidney and HOCM, you don't have to do the test, but you can do the ultrasound or HOCM by the age of 18. Okay? In non-preventable, non-treatable diseases, you discourage doing the test and you explore to the person what are the drawbacks of doing this test. Okay, what are the pros and cons of doing this test? First of all, let's explain the nature of the test. It's simple blood test that is checked by expert to do what is called genetic map. There is this test is not 100% accurate. There is percentage of false positive in which you may have positive test and you don't develop the disease, and false negative in which you have negative test and you have the disease. In order to exclude these fallacies, we have to take samples from other persons in the family, affected family members, which may breach their confidentiality and needs their consent. The impact of these tests on your social, family, job, insurance, marriage, children is important all to consider. Some jobs refuse from the start if you have certain disease, like for example Huntington, they refuse to apply in the military or the jobs like dealing with firing or risky jobs. They refuse you from the start, even if you don't develop the disease. So you are going to live a stressful life and you may not develop the disease at the end. Another issue is the insurance. In some diseases, you lost your right in insurance if you have these diseases. So it is important to consider this issue. Sometimes there is unexpected informations, like you discover that your parents are not the biological parents. So you start to explain the pros and cons of this test. On the other hand, after all this stressful life and these impacts on your social life, your job, your insurance, there is no preventable treatment or even treatment for the disease if it occurs. So what is the gain you consider if you do this test rather than living, waiting for having the disease at the point? Okay. طيب, if you still insist to do the test, okay, why don't you reconsider? We are not in a rush. We can meet you in a month or so. You have to read more about this disease. We can repeat the counseling again. And if you insist, I'm going to refer you to genetic counselor. This for non-preventable, non-curable disease. طيب, the issue is totally different in preventable or curable disease. You encourage, you tell, please bring your first degree relative to counsel them about the disease because it is preventable, and we put their health at risk if we don't counsel them early. في certain situation in genetic test that you may face in the exam. First of all, the patient coming with an information that one of his parents have a disease, genetic disease, and he want to check himself. You proceed in the way that we mentioned, and you let the decision for him at the end. If the disease is one of the preventable or treatable disease, you have to encourage doing the test early. And you don't have to mention the bad effect because they are not practical here. If the patient asks you about a relative, for example, I'm not a patient, I'm a daughter of a patient with genetic disease, and I want to run the genetic test for my kids. The parents do not have the right to perform genetic test for their kids as long as they are minor. Minor يعني below 18 years of age. If they are below 18 years, you don't have the right to do the test for them if it is non-preventable, non-treatable disease. It's their own decision when they grow up and become competent. If the disease is preventable or treatable, خلاص, this is ended issue. We have to do it for all the first degree, all the whole first degree relatives. Clear? If the patient coming asking you about a husband or the partner, shall I tell him? This is another issue that we are going to tackle in our next scenario. So who is ready to do the next scenario?
Hello?
Hello?
Can I do it?
Yes. Can I know your name, please?
مصطفى.
دكتور مصطفى. دكتور مصطفى، ازاي الحال؟
الحمد لله. ازي حضرتك يا دكتور؟
الحمد لله. Perfect. Mrs. Rehab, 32 years old lady, whose mother has been on dialysis due to autosomal dominant polycystic kidney disease. Her mother's doctor asked her to check the possibility of having the disease as a first degree relative. Your task to counsel her about the disease and manage her concerns.
Okay.
When you are ready, please tell me.
Okay. Can I start now?
Yes, sure. Let's start.
Okay. Good morning.
Good morning.
I am Dr. Mustafa, one of the medical team here.
Pleased to meet you, doctor.
Nice to meet you. Are you Mrs. Rehab?
Yes.
Okay. Can I ask you if you know that we are going to talk today about your mother illness and the risk that you may got the same disease like her?
Yes, doctor.
Okay. Can I ask you what you know about the illness of your mother, please?
Actually, doctor, I don't have much idea. You know, 5 years back, my mother have been complaining of a problem. Even I cannot recall what she was complaining at that time. But they told us that she has to start dialysis. And she has been put on dialysis for the last 5 years. Actually, she's suffering much with that dialysis. And once I was bringing her from the dialysis unit, I met her doctor. He asked me, have you ever checked your kidney? I wondered why. He told me that the disease is running in family and there is a possibility that it may affect me. So I got worried and I came here to discuss further with you.
Okay. Did you hear before about disease called autosomal dominant polycystic kidney disease?
Just my mom. It is the first time.
Okay. Can you let me explain to you, please, about this?
Yes, please.
Okay. This disease actually running in families. Actually, if one of the parents having this disease, there is a chance 1 in 2 that one of his siblings will have this disease. Actually, it appear in the families, but we cannot expect it or record it before one of the relatives above 18 years. What we are going to do, that we are going to make imaging for your abdomen, checking for your kidneys. If there is some special character in your kidney, we will decide if you have susceptibility for this disease or no. We are going to make some blood tests for you for the kidney function, checking your blood pressure, and we can check for some other images in the brain if needed. Actually, you are 32 years old now, so
Yes.
you are susceptible to go for this investigation of imaging. We are going to make some appointment to make the what is called.
Doctor, why
Yeah.
you mentioned I have to do imaging in my brain to my brain? Am I getting
Yes,
this right?
yes, I am right. This is some cases what we have the like small cysts in the kidney. It can be in different parts in the body, like the liver or the spleen, but it can affect also some blood caliber in the brain, making some dilatation in it. So we are getting, if there is some risk of that, we are afraid that sometime if this dilatation is going to make bleeding in the brain, so sometime we can do this imaging for protecting you from going more risky in what is called bleeding inside the brain. So this could be happening. So we may go for this imaging for your brain at one time.
Oh, doctor, you mean shall I do a genetic test for knowing if I have this gene or not?
Actually, no need for genetic testing for your condition. The imaging, which I told you before, which through your kidney, we will look for what is called cysts in your kidney. If there is no need to go further for any more labs. If we find some cysts in the kidney, according to how many, we will go a regular follow-up with you, checking your blood pressure regularly, try to control if you have any increase in blood pressure. And as I told you, we can go further to look for this cyst in any other organs and to make the images for your brain.
Doctor, if I prove to have this problem, does this mean that I have to undergo dialysis at one day?
No, not now. Actually, this, like your case of your mother, she go for dialysis in old age. We suspecting that patient having this disease can go for dialysis as they're 60 of the age, but we try to do our best to control if you have any high blood pressure, as I told you, to get you from any risk of having this brain tumor. And we'll try to give you all the best treatment as we can.
So you mean there is a treatment that can prevent the progression of my condition or cure my problem?
Actually, we cannot cure the problem, but we can control. If you have high blood pressure, we can give you some medicine to control it. If we suspect you have this dilatation in the brain, we can refer you to one doctor for the brain surgery. He can make some minor operation to prevent you from going to the bleeding in the brain. But fortunately, I cannot tell you we can cure it 100%.
This is very, I'm not sure what to say, doctor. What is the impact of this problem on my marriage and future family? You know, I'm planning for marriage after a couple of months. Shall I mention this problem to my husband? Can I hide this problem from him if I have it?
First, I
And
wish you
can
all the
this
best.
affect my kids as well? And
I
is
wish you
there
all
any
the
way to
best.
prevent?
This is rehab for this, for your coming wedding. Actually, to telling your partner or no, this will be up to you. For your kids, actually, as I told you, until the age of 18, we will be uncertain about the possibility of if they will get the disease or no. So all what we can do, we will wait for them when they get in the 18 years old, and then they can go for the screening of the imaging. But if you are already don't have this disease when we do the imaging, so we'll be sure that your kids will not get the disease.
Yes.
Can I ask you some question about your occupation?
I'm a secretary.
Okay. Do you smoke?
No.
Do you drink alcohol?
No.
Okay, that's good. Can I ask you if you have any concern, please?
لسه معاك 4 دقايق. Yes, doctor. Actually, as I told you, I'm concerned about this genetic test. I will be feeling more comfort if I know the result of this test is negative, and I just will plan my life accordingly.
As I told you, we hope that the test will be negative. If we didn't find the cystis in the imaging of your kidney, so we'll be sure that you don't have the disease. If you find this cystis in your kidney, so as I told you, what we are going to do that we put you under close observation. We'll give you some advice about controlling your blood pressure.
Is there any kind of treatment that I have to take if I have this diagnosis?
Actually, no specific treatment. We try to decrease the risk factors. If you have blood pressure, decrease the risk factor to getting the bleeding in your brain, but I cannot give you specific treatment for that.
What about my brother, doctor? He is now 16 years old. Shall I do genetic test for him?
No, I am sorry, we should wait for a while. He is still junior to do the test. Maybe after 2 years, when he is 18 years, if he would like to go through the test, it's okay. But you cannot ask him to go through the test now, because by law, we cannot force him to do the test at this age.
But it is important to know whether or not he will develop this problem. So I think he should do the test.
Of course, it's important, but again, you should give him the chance when he is 18 to decide what he wants. Maybe he don't want to know about it. At that time, of course, we'll give him the advice to go through the test if he will agree. But in this age, still now, it's very early for us to decide. And as I told you, before 18 years, it will not be very clear to us to decide if we will get the disease or no.
Yes, doctor, does this problem affect my fertility?
Actually, if it didn't affect your kidney function and your kidney function is good, I don't suspect that it will affect your fertility. And I told you to make effect on your kidney or go to more damage. I think this will be very late in the 60s. So I don't think it will be having a high effect on your fertility.
Another question, please, doctor. If I'm planning to have kids in the future, is there any way to prevent them from having this disease from the start?
If you decide and you want this, we can discuss this with your genetic doctor and the gyneco-obstetric doctor. They can take some sample from the fluid around the baby to decide. And at that time, if you decide to go for abortion, it will be your decision.
Okay.
Can I summarize to you what we discussed today?
Yes.
Okay.
Yes,
as I told you, your mother have a disease, which you have 50% chance that also you carry the disease from her. So we are going to make the imaging to see if really you have the disease or no. If you don't have it, so we are sure you don't have the disease. If you have the cystis in your kidney, so as I told you, we'll go to close observation to protect you from high blood pressure, to protect you from going to brain bleeding. As I told you about your brother, we will wait until he is 18 and he can decide for himself if he wants to go through the test or no. Is any of what I said is not clear from you?
No, thank you. It's very clear.
Thank you. Can you tell me what you got from our meeting today?
Yes, I got that this disease is running in family and there is 1 in 2 chance for each of the siblings to have this disease. and that when my brother reach 18, he has to check his kidney, and I have to check by image and regularly check my blood test. Hopefully I don't have the disease.
Yes.
Okay. I am going to give you also some leaflets now about the disease. You can read. You have the
Thank
phone
you.
number,
I am
clinic, if you
finished.
need inquiry. Okay.
Thank you. Perfect يا دكتور مصطفى، عملته you did it very well, but I have a projection on the part of the brother. Genetic test has no meaning in autosomal dominant polycystic kidney disease or HOCM, because the test already, the disease already start to manifest itself by the age of 18, so no need to undergo any genetic test, especially we are not going to give him a treatment. But when he reaches the age of 18, he has to. It is not violation, but it is one of the diseases which can be prevented. Actually, recently, you can say it is preventable disease. Not completely preventable, but on the way to be. At least you can delay the progression of the disease by good control of blood pressure and regularly monitoring kidney function and urine for infection, avoiding drugs, and so on. But my objection that you told here, it is not your right, it is his own decision because he is minor. This does not apply to this scenario. This apply to non-preventable, non-treatable disease. Okay, like for him, yes, it is important to screen him, but by imaging when he reaches the age of 18. So when he reaches the age of 18, we should counsel him about the importance of doing this test. Otherwise, you run it in a good way. Actually, I'm sorry for I'll start, Dr. Mustafa. Sometimes the scenario is vague. I don't have a clear statement how to set the aim of the meeting. You don't have to read what is or tell what is written in your paper. Just tell her if she's coming for counseling, for any counseling, the patient coming to ask you about question. You don't, or the person, you don't ask it, meet her. For example, a daughter coming want not to discharge her mother from the hospital, or notice unacceptable behavior from the one of the medical team and or the doctor, and want to complain to you. Here, you are not aware why she wants you, despite you have a scenario, but in reality you don't know. You know that she wants to meet you. So you tell her from the start or the beginning, I know know that you want to talk about something to me. Would you tell me how can I help you? Or you ask it to meet me for certain issue related to your mom. How can I help you? How much you know about your mother condition is okay. Now let me tell you more about the condition. Autosomal dominant polycystic kidney disease, or let's call it polycystic kidney, just simplify it because you are going to use the term many times during your conversation, is a medical terminology given for a disease, one of the diseases running in families, in which there is some defect in the kidney, resulting in replacement of the normal kidney tissue by fluid-filled sacs or cysts. This fluid-filled sacs or cysts increase in number and size by time. So usually by the age of 50, late 50 or 60, the patient start to have symptoms of kidney failure, and he need what we call kidney replacement therapy, as what happened to your mother. This disease affect, or there is a chance of having this disease 1 in 2 for each one of the sons or daughters. 1 in 2 chance. We don't need to do genetic test because this disease, when it is present, it expresses itself by showing this cyst by the age of 18. We can sign it out by imaging called ultrasound. If these cysts are present, this means you have the disease. If not, this means you don't have the disease, but we have to follow up you. If these tests are present, we have to regularly put an eye on you. You have to regularly check your blood pressure, your urine for any bugs. Avoid taking any medication without counseling a doctor and telling him that you have this kidney problem, especially painkillers and some of the antibiotics that may harmfully affect the kidney. And also, you should drink plenty of water. Fortunately, there are now some new drugs that prove to delay the progression of polycystic kidney. They don't prevent the disease completely, but if used in early stage, they can delay the progression of the disease. Regarding your marriage, I'm happy to hear this good news and wish you happy life. But regarding telling your husband, it is your own decision. If you would like to tell him, it will be better. So being honest with your partner, make him able to share you the hard moment as well as good moments. You can have his support at that time, and you can share your way of thinking about the kids. Regarding the coming kids, there are some new technology that use selection of ovum, of healthy ovum, to avoid transmission of the disease to the kids before pregnancy. So you have to have a planned pregnancy if you prove to have the disease. It does not affect your fertility by any way. Regarding your brother, it is advisable to start testing him when he reaches the age of 18. We should screen him by ultrasound. But right now, no need for doing the genetic test. As I mentioned to you, there will be no treatment right now, and it will not be of benefit to do the test early. So how do you feel about this? Let's sum up ونconsider. طيب نيجي لإيشو مهمة that you tackle, which is the MRE علشان cerebral aneurysm. Guidelines does not recommend MRE for every patient with polycystic kidney disease, but you have to ask her, have you any family history of any family member with early death or stroke? If she has, this is the only indication for doing the MRE, especially she is not diagnosed yet. But even if she come to you counseling about the polycystic kidney, she has her mother with polycystic kidney, and she now did the ultrasound and counseling you post-test counseling about the disease, you don't have to mention MRE unless if there is family member who died from brain hemorrhage or have unexplained early death. Otherwise, they consider it as if you are frightening your patient. So don't mention this except if indicated, and this is very important.
Okay.
Clear? Yes. Any questions? Yes, I think this is a medical jargon. You mentioned fluid filled sex, which could cyst. Yes, you have, if you explained it once, you can use the terminology after this, but you have to explain it for the first time.